and we have a very exciting event for us. If we can move the slide on, I would walk you through some announcements that we have. The general announcements really are about the fact that we're recording this webinar and live streaming via YouTube. The recording will be available on our website at events.fip.org, and you can ask any question that you like during the session, either through the chat, introduce yourselves through the chat, which I'm seeing you do, and also asking questions through the Q&A box so we can keep a record of them. You're most welcome to provide feedback, and additionally, if you'd like to join FIP, please do so. So the learning objectives, what we really all want to achieve today is to learn about the global perspectives on primary healthcare and universal health coverage. And that's since Astana in 2018. So we're taking a 5-year look today. We'll walk you through the FIP journey and alignment with the WHO's primary healthcare agenda and the Astana Declaration. We'll explore what's changed in terms of the global threats and priorities. We'll use the time to engage with some of our priorities on pharmaceutical service provision and reflect on the WHO's perspectives, and then work with you through the whole event to share the opportunities and challenges to 2030. Next slide, please. We've got opening and introduction. I'll walk you through who's with us today. I'll walk you through the 2018 to 2023, the 5 years since Astana. The team, two of the team at FIP, Farah and Isu, will walk you through this year, reflecting on the WHA 76 challenges in reaching the SDGs, and also our work on regional engagement. We've got some presenters as well who walk us through the challenges and the opportunities for us, taking a look at workforce, humanitarian response and technology, looking at the benefits and the risks of each, as well as our colleague from WHO who'll provide their reflections. Got a panel discussion, and then I'll make some summary remarks at the end. So to introduce colleagues today, I'm delighted to have Farah and Isu from my team, and also we have other members from the team here who will be responding to questions and adding links about our responses to various elements as we go through the event. We have Susanna, we have Ines, and we have Oscar, and we'll get them to be on camera during the panel discussion. Today we have, it's my pleasure to introduce Dr. Farah Khalid from WHO, Mr. Mark Koziol from the PDA, Dr. Lars Söderlund from FIP Vice President, Professor Ian Bates, not able to be with us, but has sent a recording, and Professor Kirsty Galbraith from Monash University, who is a lead in our hub. It's really a great event today. And before we get going, we want to engage with you. So we have a couple of activities where we want your input, your reflections, or even your challenges and where we need to focus. So I'm going to hand over to Farah now, and she's going to walk us through the first question. Farah.
Thank you, Catherine. So we've created 2 engaging Mentimeter activities for you, our audience. The first activity is a word cloud, where we invite you to think about the 3 biggest influencers on global health, both within the pharmacy profession and in wider societal elements in global health in 2023. So to join us, if we go to the next slide, you can simply scan the QR code provided or visit menti.com and use the code 54901007. We'll also share this information in the chat for your convenience, but we will get back to the results to review what you've added before our panel discussion begins. So we will allow you some time to submit the 3 words and think about these words as we approach the panel session. I'm going to hand it back to Catherine now.
Lovely, thank you, Farah. So I'm going to walk you through the global health agenda, the global pharmacy journey in the past 5 years. And it's very important for me to reflect on those 5 years since I joined FIP as CEO in the June of 2018. So it's a bit of a marker for me to think of 5 years since Astana. Next slide, team. So we attended the Astana meeting in Kazakhstan in October 2018, which itself was a 40-year anniversary reflection on the Alma-Ata, where primary healthcare was really launched. And the meeting 5 years ago was one of reflection, celebration at what had been achieved, but also some sober thinking around the primary healthcare challenges we are all facing. And pharmacy hadn't been front and centre to the primary healthcare agenda. The issues that WHO and the UN were mentioning were universal health coverage, and that primary healthcare was fundamental in that. And pharmacy is fundamental to primary healthcare. So we signed the profession up to play our part and to keep ourselves in check about what we are doing to deliver. Next slide. So these are the main areas that we signed up to as the profession, where we will apply knowledge as well as scientific and traditional to strengthen primary healthcare. We'll create decent work and appropriate compensation for healthcare professionals. We support across healthcare services safe, effective and affordable medicines. And we call on all countries to continue to invest in PHC. So you can see that the declarations, the commitments really sit very neatly and very aligned with FIP. So the next job was to ensure alignment overtly. Next slide, team. So we worked on some key areas of collaboration that we could build with WHO. We've been in formal relations with WHO since its inception in 1948. WHO is 75 this year. And we have a triennial work plan that rolls over. But in addition, we wanted to really focus on how we would mobilize and operationalize the Astana Declaration. The key areas of collaboration are patient safety, AMR, medicine shortages, strengthening the pharmaceutical workforce and education, access to safe and quality medicines. And for our members in FIP, we really focused on the management of NCDs, the safety agenda, and the prevention agenda. NCDs, not just the 5 that the UN mention and focus on, but also the management of patients who live with many more in addition. The patient safety agenda, from drug discovery to drug development, from repurposing to substandard and falsified medicines, all the way through to shortages and safe supply. And then, of course, the prevention agenda, from self-care all the way through to vaccination and immunization. And this really set us off in 2019 with a clear plan of action for the years ahead. Next slide, team. In 2019 as well, the WHO launched its 5-year strategic plan with the 3 billion target, ensuring 1 billion more people benefit from access to universal health coverage, 1 billion more people are protected from health emergencies, and 1 billion more people enjoy health and well-being. And I think it's a sobering moment to consider that the pandemic got in the way a year later, and I would imagine that less people have access to universal health coverage, less people are protected from health emergencies, as we see in the world today, and less people enjoy better health and well-being. And it's important for all of us to line up, stand shoulder to shoulder in this shared agenda. At that time, in 2019, there were 10 global threats identified. And again, we see weak primary healthcare being listed. We also see vaccine hesitancy. We see some of the communicable diseases and non-communicable diseases. We see fragile and vulnerable settings. And we also see air pollution, a pandemic, and AMR. So it's very sobering to think that the threats identified in 2019 have themselves become greater since then. Next slide, team. In parallel, in our 79th Congress in Abu Dhabi in 2019, the FIP Council approved the strategic plan that takes us through to next year. Our vision is for a world where everyone benefits from access to safe, effective, quality and affordable medicines. And our mission is to support global health by enabling the advancement of practice, science and education. Our next strategic plan will take us through to 2030, which will also really focus our minds on the SDG delivery as well. Next slide, team. And you can see our journey since 2018 in attending the Astana Declaration, the Global Conference on Primary Healthcare, has really focused our minds. We also started then some regional engagement as a result, which meant that we were able to get commitments to primary healthcare across each region. In 2019, we hosted one in Eastern Mediterranean, in Amman in Jordan, and then later that year, around this time, 4 years ago, we hosted one in Ankara in Turkey. And the commitments there were regional plans, a regional focus on getting a commitment to the priority areas in primary healthcare at that time. A year later, in the midst of a pandemic, which was really focusing everyone's minds, we launched the FIP development goals. That was on the 21st of September in 2020. And the year later, we hosted a global summit on primary healthcare and launched our commitment to action and our digital toolkit for primary healthcare. Last year, we launched our primary healthcare world map, and we also had the anniversary of 1,000 days living with COVID. The 1,000 days was mapped into 10 blocks of 100 days, mapped from the 30th of January through to the 25th of October. The reason we did this was to inform our pandemic preparedness work, but also to really monitor and map the experiences at that time. And today we will walk you through the impact database, where we start to mobilize the evidence of impact that we have in our libraries. We start to enable members to identify the evidence that exists out there. I think it's a really important set of milestones for us to reflect on. And the team themselves are going to walk you through how we have continued with these work streams in the 5 years that has passed. Next slide, team. So it's important, as I mentioned, for us to align. This slide shows you the Sustainable Development Goals, and the next slide will show you the FIP development goals. And these build on work that had been already in place in response to the Human Resources for Health. In 2016, FIP launched the Pharmaceutical Workforce Development Goals. Those 13 goals remain embedded in these, I suppose, broader 21 development goals. The issue for us is that it's not only about the workforce, it's also about science and practice and about patient care and public health. So by embedding the workforce development goals into every single one of these, we can showcase and share what we're doing. The development goals support the transformation of pharmacy in line with the UN SDGs. And now they help us to align our work to the development goals and to the SDGs, and they enable us to hang our work on these 21 areas. Next slide, team. So now I'm going to hand to Farah as we walk you through the impact database. The idea of constructing a compendium of work came about during the pandemic. As we saw, many people were mining the FIP databases and libraries to see what we had on file, and additionally, how much the team starts from the work that we've done before. A secondary point to make is it's really important for FIP to stand on the shoulders of giants, and a lot of work exists in FIP from our volunteers and officers. And in addition, we will walk you through how important it is for FIP to provide evidence-based briefings for our engagement with health ministers, not only on a global level, but at regional level, and then to support in nation. The GPO, our Global Pharmaceutical Observatory, was tasked with the project, and it's nearing the first stage as the FIP impact database. It aims to provide full searchable access to the library, and eventually we will build on this and grow this so that we include all publications where FIP's reports, cited policies, and programs are referenced. And it's really there to support us as a team, but us also as the wider FIP with the evidence of impact and influence. The member organisations can use the database to help with national advocacy. It's really important. So the team will walk you through the video on the next page. Thank you.
So I think we'll need to share the screen again as we fix the audio issues. I just wanted to say that this is just what we'll present today is basically a prototype that we're working on of how the impact database looks like. For this, for now, this includes everything that we have in the FIP library.
This is
but as
our
Catherine
impact
mentioned,
database,
we will
showcasing
expand this.
evidence-based achievements in practice, workforce, and policy. There are 3 metrics for measuring the impact of our publications: impact by publication theme, impact by FIP development goals, and impact by FIP programs. On the main screen, you'll find 3 charts representing each impact metric. On the left-hand side, you'll discover filters to customize your view. Select a specific year or impact metric to assist you in searching for publication. To navigate this database further, simply click on the different tabs in the menu to access a more comprehensive breakdown of the evidence of impact from each metric. When you click on Impact by Publication Theme, you'll see a detailed breakdown of publications categorized by their respective themes and sub-themes, as shown in these 2 charts here. For instance, by clicking on the blue bar, you can see that out of all 100 publications related to workforce development, 20 specifically align with continuing education and professional development programs, 8 with medication therapy and management, 2 with patient education, and so forth. You can observe the type of publications that fall within the workforce development theme or other themes. These types of publications can be frameworks, guidance, handbooks, reference papers, reports, statements, or toolkits. You can also observe how trends have evolved over the past 10 years. Hover over data points or click on bars to view additional information and specific details. When you click on Impact by Development Goals, you'll see 2 charts here illustrating the alignment of our publications with FIP development goals. This alignment is achieved by categorizing each publication into 2 different development goals. For example, if you click on DG16, you'll see that publications related to communicable diseases also align with other DGs, such as DG7, Advancing Integrated Services, DG5, Competency Development, DG13, Policy Development, and so on. You can also explore the type of publications and their trends over time. Likewise, as you evaluate the impact of our publications within FIP programs, you'll observe that each publication is linked with 2 distinct programs. As you can see on the screen, the majority of our publications fall under 3 programs: Transformation Program, Prevention Program, and Sustainability in Pharmacy Program. Click on the Abstract and Summaries Brief Overview for a comprehensive list of our publications throughout the years. The URL link for each publication is available on the right-hand side. To streamline your search for publications, you can use filters that is available on the left-hand side. You can submit your case study by clicking this button here, or you click here to see detailed list of abstracts. Type the keywords over here to search for the publications. You can access the FIP library by clicking this button. Click Home to return to the home page. Feel free to explore the various tabs or filters to customize your view and access the information you need. If you have any questions or need assistance at any point, please do not hesitate to contact us at observatory@fip.org. Thank you.
Thanks, team. So let's move on to the next slide. And Before I hand over to both Aysu and Farah, one of the things we wanted to do today is to focus on 2023 and to think about what's happened in this year, but also then how that sets us up for the next 5 years since Astana. The team, by the way, colleagues, are filling up the chat box with links to all of our different areas of work and work streams. Now, I'm going to hand to Aysu in a second to walk us through the World Health Assembly 76, which was held in May this year. And this is a slide, a picture of everyone who was there at the FIP reception. And we're just so delighted to be blessed with such great colleagues. The next slide just walks you through a few statistics and learnings from that. At the WHA, the World Health Assembly, FIP delivered 3 constituency statements and 5 individual statements. We actively participated in over 50 side events. We engaged in important meetings with WHO colleagues on tobacco control, substandard and falsified medicines, meds regulations, patient safety. We had a strong presence with participation of 21 delegates, including 6 official delegates. It included myself, Bureau members, Lars is here today, and representative from member organisations, and Mark is here today, who was also present with us. And we just thank all of our Bureau colleagues, the team at FIP, but our member organisations most specifically, for their contributions and their activities. A big moment of thank you. Thanks a million. Next slide, team. So Aysu, who is the FIP Policy Practice and Compliance Manager, and Farah, who's FIP Regional Engagement Support and Development Manager, will walk you through the next 2 sections. Aysu, I believe you're going to walk us through WHA 76.
Thank you, Catherine. Dear colleagues, first I would like to share some discussions about the WHA strategic roundtables that we attended. So the first roundtable was about the pandemic prevention and preparedness, and the key issues discussed here: the need for strengthening early warning systems and addressing underlying drivers like climate change and poverty. So for FIP, it is crucial that we actively engage in understanding and influencing our international healthcare regulations. And moving on the healthcare and workforce roundtable, the session highlighted the high prevalence of anxiety, stress, and burnout among healthcare workers. And the key issues is a global workforce strategy and the importance of education and training in this area. And we recommend that emerge, where we develop a comprehensive global strategy and also offering a competitive salaries to health workers. And for the health community and on climate crisis, we know that health community play a role in raising awareness of the health impacts of climate change, and this can be done through public education campaigns, training for health workers, and advocacy with policy makers. And FIP also recognized the significant health impacts of climate change and encouraged strengthening the role of pharmacists in climate change climate change mitigation and its adoption. For the next strategic roundtable, it is the ending tuberculosis by 2030. And the key issues were the need to address social determinants like poverty and stigma, and the need for new tools and approaches. And FIP and WHO have a joint declaration on the role of pharmacists in tuberculosis care, and it is important for pharmacists to advocate their integration into tuberculosis care policies. For the immunization roundtable, the roundtable examined the factors contributing the remarkable progress made by many countries in immunization recovery. And from FIP's standpoint, pharmacists play a crucial role in building vaccine confidence and ensuring universal access to vaccines. And for the final strategic roundtable, tobacco control, the key issues included the tobacco industry's efforts to undermine control efforts and the high cost of cessation products. And FIP is actively collaborating with WHO Tobacco Control Unit, and pharmacists are well positioned to offer effective tobacco cessation services. So here you can also see some challenges related with healthcare force and also several resolutions. For pandemic prevention, preparedness and response accord aims to establish a robust global framework for dealing with healthcare emergencies. And this involves not just systems, but also the professionals who run them. And the second, WHO puts strong recommendation for tackling non-communicable diseases and mental health. And this is a call for immediate action and increased investment, particularly in workforce training and support. Lastly, a renewed focus on universal health coverage was made and spotlighting primary health care, and the 2024 UNGA meeting on universal health coverage is a crucial milestone, and it is an imperative that healthcare systems align with the principles of Astana Declaration. So here are some resolutions that I want to share, and these are provided by WHA 76, and they offered multifaceted approach to these global health challenges. And in this slide and the next slide, you will see the challenges from strengthening our global architecture in emergency preparedness to focusing on vulnerable groups like women and children, and the budget, and also resolutions on social determinants of health, well-being, and emphasize a more holistic approach for the healthcare. And also there's a specific focus on eradicating polio and addressing regional concerns. And here I would like to talk about the after WHA, what are the path forward for us. And we are considering some immediate actions, including adapting WHO guidelines into national healthcare policies and strengthening international collaboration, particularly in pandemic preparedness and mental health. And also we have some long-term goals and actions and aims that should be achieve universal health coverage in our healthcare systems to focus on primary healthcare and addressing the root causes of health inequities as laid out in the WHO resolution on social determinants of health. And after WHA 76 participation, we published a summary report about FIP representation at WHA 76. And you may see the report if you can scan this code, and it includes some key insights and directions for our member organizations. That's all I want to share. And now I'm heading back to you, Catherine. Thank you.
Thanks a million, Isu. So what we've been doing in parallel is to evaluate the impact of our engagement where health ministers are present. And the ambition for 2024 is to use the learnings of all our WHA sessions, but additionally engagement with health ministers. The one you see on the right there, the picture is with our member organisations and the health ministers from Australia while we were there in Brisbane in September. And the plan then is to showcase and evaluate a plan for 2024 where we will attend meetings where health ministers are present, and through our volunteers and our member organisations ensure that they can present evidence of impact against all of the big priorities in the region, in the nation. Using this approach, we believe, is a very important advocacy tool, and areas will be around our Astana Declaration, but also what is the priority in a nation. So lots of learnings for us to do there. Next slide, team. And now I'm going to hand over to Farah, who's briefly going to walk us through the challenges that we face in reaching and delivering the sustainable development.
Thank you, Catherine. So I will start by sharing 3 important statistics concerning global primary healthcare and the impact basically on the Sustainable Development Goals. Firstly, an alarming fact: 930 million people worldwide risk falling into poverty due to high out-of-pocket health spending. So it represents over 10% of their household budget. The second one is the scaling up primary healthcare interventions across low and middle income countries. It has the power to save 60 million lives and increase average life expectancy by 3.7 years by 2030. And lastly, the lack of essential health services. As of 2021, 4.5 billion people, so roughly half of the world's population, still lack access to essential health services. And these statistics underscore the urgency of addressing global healthcare disparities and the immense potential for the positive change. So as we are at the midpoint between the SDGs and the destination we must reach by 2030, if we can go to the next slide, I want to highlight several major health trends that has shifted over time. First is this shift from communicable to non-communicable diseases. We know that we are having improvements in sanitation, vaccination, medical treatments, and many communicable diseases have declined, especially in the middle and high-income countries. So the NCDs, like the heart diseases and diabetes, have become more prevalent. Secondly, we have a reduction in the child mortality, and we know that global initiatives are currently targeting polio, measles, and other childhood diseases. It had reduced child mortality over the past few decades. Thirdly, we have the improvements in maternal health. So initiatives targeting maternal health have reduced deaths due to complications during pregnancy and childbirth. Next, we have the aging population. With increasing life expectancy, there's been a rise in deaths associated with age-related diseases like Alzheimer's. And then lastly, we have the impact of lifestyle and urbanization. With the global rise in sedentary lifestyles, unhealthy diets and tobacco use had made more diseases more prevalent. And the urbanization has contributed to pollution and respiratory diseases. If we go to the next slide, what is the progress on SDGs achieving the target, the 2030 target for primary healthcare? First, we have an increased awareness and commitment from the global community. Resource allocation, countries have been working towards strengthening their health systems, focusing on equity, quality, and financial protection. We have innovation and technology, and indeed, this is one of the themes that we will cover today. So the use of telemedicine, mobile health, and digital health platforms, bridging healthcare access gaps. And lastly, partnerships, collaborations between governments, non-governmental organizations, and private sectors have indeed resulted in integrated primary healthcare models. And if we go to the next slide, we know that globally health is generally improving, but we have some areas where we see them left behind. And this is because large countries have substantial influence on global statistics. So reporting often focuses on averages. Potentially, we overlook small to medium countries or specific vulnerable populations within those larger nations. And some of the challenges that we want to highlight on SDGs are on the screen. The first one is the shortages of healthcare workers. Many regions, especially in low-income countries, still lack the basic healthcare facilities and the trained personnel. And the major challenge is the shortage of trained healthcare professionals, especially in the remote and the underdeserved areas. Health inequities, despite efforts, disparities are still there between and within countries. Funding gaps, while funding has increased, it remains insufficient to meet the 2030 target. We have the political instability in some regions, disease outbreaks, the unexpected health crisis like the COVID-19 pandemic we're all aware of, and the rise of non-communicable diseases such as diabetes, heart diseases, and cancers, as we mentioned. If we go to the next slide, we know that pharmacy is central to achieving the UN 2030 Agenda on Sustainable Development. And the UN recognizes that the pharmacy workforce is essential to achieving SDG 3, that is ensuring health lives and promoting well-being for all at all ages. If we go next, what we've worked on is to map the FIP development goals to the United Nations Sustainable Development Goals. And this demonstrates the strong and the clear alignment between the two sets of the global goals. And while the priorities at FIP may change and adapt to members' needs over the coming years, some of the SDGs will always remain at the core of what we do at FIP. So we worked on a roadmap, which we'll share the link to in the chat box. And this roadmap provides an indicative mapping to illustrate those alignment. And you might find an interactive version of the mapping on our webpage, our web version of the roadmap in the Development Goals microsite, which we'll also share in the chat box. If we go next, you'll see the guiding principles that the FIP Bureau and Site Board identified. Those are the key imperatives and guiding principles that will underpin all of the work that we will carry out during this decade and beyond. If we go to the next slide, to deliver the global roadmap, these strategic and organizational enablers will be, of course, key. You can see them on the screen, and the details, again, you can refer to the details in the roadmap microsite, the DG's microsite. If we go next. This is the Road to 2030 Decade of Action for Pharmacy. Again, it's marked by the significant milestones that we aspire to achieve, and FIP recognizes the legacy work, especially that of the last decade, which this roadmap is underpinned by. We're planning, as Catherine mentioned, to engage with the health ministers, renewing our strategic plan in 2024 and planning other milestones to show impact and delivery in 2027 up until 2030. This basically serves as an enabling tool for our members and the global profession. And with that, I finish my presentation, and I'm going to hand it back to you, Catherine.
Thanks a million, Farah. So we identified for the focus of today to really think about the opportunities and the threats that sit within three main areas. We will be starting with a perspective from WHO around the progress made, but also the progress that's needed. And then we have three speakers on workforce development, workforce imperatives. We have an example, a snapshot of humanitarian, environmental and structural determinants, and then also innovation and technology. And each of our speakers will be walking us through, from their perspective or their experience, solutions as well as challenges and lessons for FIP. And that will probably be the steerer that we will take from today alongside the priorities that you've identified in your Mentimeter. As Farah rightly says, we have a roadmap to 2030, and now we are putting all of the pieces, the jigsaw pieces together to deliver that roadmap. So next slide, please. It gives me great pleasure to introduce our colleague from WHO. Dr. Faraz Khalid is the Research and Innovation Officer at WHO, based in Geneva in Switzerland. And I understand, Faraz, you will be using your own slides. So we'll do a nice little seamless crossover now to your slide deck. Welcome, Faraz.
Faraz, if you can please unmute.
All right. Okay. Great. Wonderful. Can you please confirm if you can see my slides,
Yes.
see myself, and hear me as well?
Yes, we can.
Wonderful. Indeed, a privilege to be here and having more than 100 participants coming from different parts of the world. What a fantastic group of people around. And I will frame my next 10 to 12 minutes intervention in the context of the latest evidence which we are bringing to the table. And colleagues, and I think it serves the way earlier presenters have set the scene in terms of World Health, different global health issues, how they were discussed in UNGA and the latest World Health Assembly, and the way forward. And within that, there were discussions, and there are still some skeptics of primary health care who think that whether primary health care is still an aspiration, an ideology, and to what extent is this something which can really have an impact and which really accrues results. So I would want to zoom out for a few minutes for you guys to see the role of FPI, the role of pharmacies and pharmacists in the bigger scheme of things. And within that, the evidence I'm bringing to the table today is here at WHO headquarters, we decided to come up with a global report on primary healthcare, of course, post Astana. And as we celebrated the 5th anniversary of Astana, we launched 2 days ago on Monday in Astana this conference copy of Global Report Volume 1, titled Implementing the Primary Healthcare Approach, a primer. And as I will take you through it, I'll share the objectives, but also an outline and what we had in mind while we were synthesizing it. And I would encourage the audience in this webinar, as the final copy of the primer becomes available, to really think through where you will be able to see the big picture, but also how the role of community pharmacies, pharmacists has been articulated here, and some examples from different country registrations I've come through. So that's how I would frame it. All right. With this slide, the only point I want to draw here is that, well, the whole PHC agenda is way bigger than these global reports. And I'm not undermining the role of communities, governments, different civil society actors, how they have shaped globally the whole PHC agenda. But the main point I'm trying to say here is that these global landmark declarations, reports, they do influence how do we define and operationalize PHC. Again, I'm not saying the PHC concept started at Alma-Ata. It existed in a different shape format way before that. But just to give you a quick historical perspective, so here we have a 1978 declaration of Alma-Ata. We have World Health Report, Primary Healthcare in 2008. 2010 World Health Report on Health Systems Financing, the path to UHC, WHO's Framework on Integrated Health Services, and 2018 Declaration of Astana. And these are the latest references, which I think the audience here clearly knows: Astana, Vision, Operational Framework, and Primary Healthcare Monitoring Framework and Indicators. So our vision for this global report has been, where for Volume 1, we have done an evidence review and synthesis of implementing the PHC approach. For Volume 2, it would be on PHC performance and impact, unpacking the country, regional, and global PHC situation. The key objectives of the primer have been, A, to cultivate a common understanding of PHC and the role of primary care and essential public health functions at the core of integrated health services. Secondly, to elaborate on strategies and actions within PHC operational framework levers, but also to emphasize the potential of PHC to achieve health system objectives. And lastly, through a critical analysis of policies and actions, identifying common enablers and barriers to advance PHC. We took a narrative review approach, which was guided by two foundational questions. A, in a society which has been committed to PHC, how can each of the operational levers be implemented to enable the delivery of integrated health services? Second, how can engage individuals and communities in multi-sectoral action policies purposefully shape service delivery? And we meticulously tried to tease out country registrations. So, and our criteria for selection of country registrations was those where there have been some policy changes that supported pathways towards PHC orientation, policy changes that exemplify the topics identified in this evidence review, interventions and strategies that enhance PHC orientation, policy changes that are transferable and or provide lessons for different contexts, and those which really provide the evidence on impact. The publication has three parts. First is understanding PHC's history and its power to change models of care. Second is evidence on, Second is evidence on strategies within operational levers supporting health system orientation towards PHC. And last is PHC potential to achieve health system objectives in improving health system performance and resilience. Here, I won't go through each chapter detail. You can see part 1 is more on PHC approach, foundations, history, and concepts. Part 2 is in PHC approach implementation, and third is the impact on performance by the PHC approach. We have around 50 country illustrations spread across the globe. And the part 1, as I mentioned earlier, it's about, it highlights how global commitments to fundamental principles of PHC, they have cultivated a common understanding and the specific role of integrated health services. And it lays out a pivotal role in health systems of 21st century and how models of care have been reoriented. So we have country illustrations here that say from Brazil and Ethiopia, how through a long-standing broad set of incremental reforms in Brazil, the family health strategy has been pivoted to improve health system performance. In Ethiopia, how through sustained efforts in health sector investments, using a PHC lens, they have been improving health outcomes. Then in Lithuania, how the links have been fostered between public health and primary care at the municipal level. In Slovenia, how primary care and public health through a community-based person-centered PHC model have been done. In Bangladesh, how community health workers have been playing an important role in community clinics as the first point of care. In Iran, how a strong network of community health workers and multidisciplinary teams has been allowing a multi-tiered referral system. As I said earlier, the part 2 is more on implementation, which presents evidence related to different levers, both on operational and strategic, and how they can be implemented with giving a PHC orientation, and what has worked well and less well. So here again, we have country illustrations, let's say from Costa Rica, how decentralized decision-making with a strong national steer has been helpful. In Netherlands, how autonomous working in teams as a basis for attractive working environments has been helpful. In Afghanistan, financing PHC in a fragile state, what does it mean and what outcomes it had, and lately what challenges it is facing. In India, how a program which has been raising awareness, acceptability, and affordability through the generic medicine has been helpful. In Mongolia, mobile health clinics bringing PHC to vulnerable communities has been useful. In Ghana, driving action on infection prevention control and the whole WHA agenda has been mainstream. In South Africa, how an mHealth application has been fostering health information exchange. Again, this is just a teaser, and it's not an exhaustive list of all the illustrations which we have in the primer. Part 3 has been on impact and performance. It's a very important segment of the publication, because we are often questioned, what are the results? What are the impact of the PHC approach or PHC orientation? So here, we've been really able to tease out examples from the countries that in terms of impact and results on quality, efficiency, equity, access, financial protection, resilience, environmental sustainability. So the snapshots from countries include China, where how expanded coverage of primary healthcare has been able to improve effectiveness, efficiency, and user satisfaction. In Thailand, transitioning towards PHC-oriented system has been improving equity, access, and financial protection. In Spain, how strong policy, PHC-oriented policy has been contributed to low levels of inequity and financial protection. In Mexico, how the PHC approach has been helpful in strengthening the health system resilience during the pandemic time. And Canada, how some purposeful interventions within the PHC approach have been helpful for environmental sustainability. We launched, as I said, the global report. There was a plenary. If you are able, these links are still active, where the Astana conference, the recordings, the web links are already there. And there was a dedicated plenary on this, which was titled Political Economy of PHC Reforms, where some snippets from the book were shared. If I have to conclude, I think there are 2 key messages where all of such publications which talk about foundational principles, definitions, frameworks, evidence, enablers, that PHC is first and foremost about fulfilling every person's fundamental right to health, and then also highlights our collective efforts in reorienting health systems towards primary health care. So that's all from my side in terms of the launch of the global report, some key findings. And I'll just say in last minute here is that some specific illustrations, examples about pharmacists' role of community pharmacies you will find in the publication, about how the role in, let's say, in multi-professional health and care workforce, organization of community-based cadres such as community pharmacists and their role in service integration has shown potential across diverse settings such as Chile, Indonesia, and Spain. Further, there have been the evidence collated on a skill mix and health promotion that found that expanded roles such as outreach, the focus on vulnerable groups such as migrants, can improve outcomes in new roles. For example, the role of community pharmacists were effective in providing lifestyle advice. Similarly, as I said, and the examples on task sharing, skill mix, and new professional roles, how they've been working well in PSC-oriented services. And not forgetting that how the community pharmacies are looked at in terms of the broader primary care infrastructure and changing models of care. There's some discussion in the publication on that. Also thinking it through that how PHC-oriented interventions, they have an impact on environmental sustainability, and how community pharmacies, they can contribute to sustainable prescription, reduction of wastage by collaborating in therapeutic education, delivering the optimum quantities at the start of treatment by ensuring professional stock management, and by committing to the return of drugs for destruction, how patients can also contribute to the proper management of their medicine stocks. So things like these, you will find they have been well reflected in the publication. So that's all from my side for now. Back to the moderators.
Thanks a million, Faraz. And I do know that you're not going to be able to stay till the end of the session. So what we might do is feed back to you any questions that we get, particularly for the areas you've discussed. Thank you so much for the support of pharmacy, and we are here to help stand shoulder to shoulder. So I'm going to move us along then to our next presentations. We have 3 short presentations for you before we convene the panel. And our first presentation has been pre-recorded because Professor Ian Bates can't be with us at the meeting today. He is the director of the Global Pharmaceutical Observatory here at FIP and chair of pharmacy education at the University College School of Pharmacy, United Kingdom. Team, I wonder if we could go ahead and play Ian's recording for us.
Hello. It's Professor Ian Bates here talking on behalf of the FIP Global Observatory. Thank you very much for asking for my contribution to this important event. What is our perspective since the Astana Declaration, and even maybe a little bit before then, from the 2016 Nanjing conference, which was very critical as far as workforce was concerned? Well, certainly in this interim midpoint between then and 2030, what has changed? Well, some things have changed and some things haven't. So, for example, our commitment to no health without a workforce has not changed. We still believe that workforce development, workforce transformation is absolutely essential in order to deliver the primary healthcare needs that all of our populations require and need. The strategic drivers for workforce development, well, they haven't changed considerably either. We still have economic and fiscal challenges with healthcare systems. Changing government policies in many countries are driving all of healthcare workforce development trends. Knowledge, technology continues to increase and become a challenge for us, and I include here digital technologies as well. And increasing complexity of patients and the demographic that we're all facing is also a continuing trend for sure. We still need a flexible and we still need a competency-based workforce planning system globally and at national levels also. Let's get more pharmacists doing more things for more patients is a recent quote that I'm putting up here for us to look at. It's a very good summary of what we need to do. And we need to enhance our focus on this particular statement leading up to 2030. This means extending our roles and our impact in particular. Our workforce model, which we started to develop in earnest from 2016, remains valid and it remains credible. We have very recently made a few adjustments to the strategic directions of some of the dimensions, but we believe that this model, which is a complex model, it has to be a complex model, but we believe this model is still valid in our mission for FIP. The challenges we have are enhancing. Certainly workforce shortages, not just in pharmacy, but in other regulated healthcare professions and in pharmacy support staff, continue to be a problem for us, including unequal distributions within countries as well. Our development of our scope of practice is definitely on an upward trend, and we need our workforce to keep pace with these opportunities. Professional migration is something that we need to investigate more, for sure. We know a lot about how doctors and nurses migrate. We know less about how pharmacists migrate between countries. And that has repercussions for regulatory issues and for standards of scope as well. Poor utilization of our competencies remains a challenge, and patient complexity continues to increase. And that is, for me now, a very primary driver for workforce development. Our most current data, this is 2022 data, continue to show an increase in workforce numbers, capacity, which is a good thing. And that should continue as far as we can be aware using our latest modeling techniques. However, discrepancies, disparities, inequalities continue to emerge. This is just one factor here. Income level, GDP, shows an increasing gap between low income and high income capacity growth, which is something we need an urgent discussion about. New issues are emerging. This is something we recently discussed earlier this year at the Brisbane conference, pharmacist prescribing as a potential additive adjuvant to tackling the primary healthcare challenges. And we are taking particular note of this in particular, as well as other efforts that we need to make. This slide is perhaps the crux of this particular presentation, our Brisbane call for actions, which was a consensus outcome of the Brisbane Workforce Symposium we held in September 2023, where over 40 countries were represented at this event. Our efforts between now and 2030 need to be enhanced. Things such as mutual professional recognition, enhancing scope of practice, so operating at the very top of our scope of practice, getting better optimization of the workforce and pharmacy team, skill mix, digital health, digital surveillance needs to continue of workforce and indicators, flexibility, resilience, and also equity and diversity. These are going to be our major themes now, leading up to 2030, with a particular focus on primary healthcare. Our development goals remain valid, they remain credible, they remain useful, and these will be our guiding framework as we continue our work with global workforce development. Thank you very much.
Great presentation there. And in summary, or in response to that, today we're taking the opportunity, the 5th anniversary, and following what Ian has just mentioned about the importance of workforce development and tackling shortages and inequities. We're really proud to be launching the report on workforce sustainability and supporting positive practice in community pharmacy, a report led and delivered by our community pharmacy section. And then, as Ian mentioned, the Brisbane calls to action 10 actions that we will be promoting and supporting our members with, as well as the wider profession. And there'll be a suite of tools and supportive guidance documents that will follow this, aligned to the roadmap to 2030 that Farah mentioned earlier, but really focusing then on these 10 calls to action. Really, really exciting to be able to launch both of these together today, and to also take a moment to notice that without our workforce, we cannot provide the pharmaceutical care that will really deliver universal health coverage. Our workforce is there to sustain universal pharmacy coverage, colleagues. Next slide, team. It gives me great pleasure now for us to take that little snapshot, looking at the humanitarian response, looking at an example in practice that can be rolled out, learned from, adapted in many different environments, especially as the crises are all around us at the present time. So it gives me great pleasure to introduce Mr. Mark Koziol, chairman of the PDA based in the United Kingdom. And Mark is a real supporter of FIP. Thank you, Mark.
Well, thank you, Catherine, and good afternoon, good morning and good evening to all of you all around the world. It's an honour to have been invited to join you today. I've been asked to look at the humanitarian possibilities and opportunities and challenges facing the world, and how pharmacists can do something about it. So the first thing that I will say is we shouldn't really concern ourselves whether it's a war, an earthquake, a tsunami or a flood, because the guiding principle for all of us is that the public in all parts of the world deserve access to safe and effective medicines. This, after all, is one of our key commitments. But as we know, victims who find themselves through no fault of their own in an area where there is a humanitarian crisis, they also deserve, some people might say especially deserve, to have access to safe and effective medicines. But often, when this humanitarian crisis occurs, whatever it is, this does not happen. So the question for us pharmacists, for our pharmacy organisations and for us as human beings is, what are we actually going to do about it? And I was involved in an episode that totally unexpectedly came my way as a chairman of a pharmacist organisation in the UK. Could I have the next slide, please? Because I'm also part of a international regional pharmacy network organisation based on the continent of Europe called EFU. And some of our members from Ukraine asked us when the war started whether we could help them. Well, what was it that we could do to help the members of the public with access to their medicines in Ukraine? Next slide, please. So the first thing that we had to do, really as scientists, is undertake some research. And we discovered very quickly hundreds of hospitals and much of the infrastructure had been destroyed. There's a big increase in hospital patients needing specialist treatment for wartime injuries, and there was shortages of specialist hospital medicines in Ukraine, and these shortages were getting worse all the time. Next slide, please. We were invited in the end by the Minister of Health to offer some support, but what we also learned was that right across Europe and all parts of the world, enormous levels of financial humanitarian support was being donated to the various charity organisations all over the world. Next slide, please. One thing that we discovered when we did a field visit to the border between Poland and Ukraine is that some members of the public were so keen to help that they were doing the wrong thing. And they were sending boxes to the border containing food, containing clothing, containing medicines, containing milk, sometimes containing all of those things. Millions and millions of boxes got sent to the border. They were being stored under plastic sheeting, in tents, in fields, in warehouses. And the Polish government said to us, there is a real major problem. If you guys as pharmacists are going to be organising a campaign, please educate the public and tell them, do not send boxes. We all know as pharmacists, looking at a pile like that, you wouldn't realistically be able to salvage medicines from those boxes and treat people in hospitals with those medicines. The other thing that we discovered, and this is what the Ukrainian government and healthcare professionals told us, is that often governments would send things that they thought might be needed, often things that have been left over. So the Ukrainians were receiving ventilators that they didn't need. nearly out-of-date paracetamol tablets they were never going to use. So the important thing that we learned is it's the pull system that's needed in a situation like this, and not a push system. This is where the crisis zone tells us exactly what it is that they need, and we do our best as custodians of medicines to try and get those medicines to that place. Next slide, please. So we decided to establish some campaign objectives. Of course, the primary objective here would be to help the casualties. But alongside that campaign, we wanted to educate the public. We wanted to tell them to stop sending the boxes, but to send money instead. Send the money to the profession of pharmacy, because we would then be able to use our expertise to guarantee the quality and authenticity of the medicines, to get it transported there properly, to get it procured properly, safe transit, and all of those other things. And alongside the campaign, we also wanted to educate the public about the special nature of medicines and the expertise that we pharmacists possess. Next slide, please. So we decided to create a campaign poster, because one thing that we did have, and it doesn't matter whether this is Europe or whether this is South America or whether this is Africa, there are tens or even hundreds of thousands of pharmacies where members of the public can either go into the pharmacy or walk past the pharmacy window. So we decided to create a campaign poster which appealed to members of the public. The picture is very important because it says what it does on the tin. If you can spend a little bit more time reading it, it says that pharmacist volunteers are working to deliver medicines, but they need financial support. We had the names of all of the pharmacy organisations pinned to the bottom of the poster, so the members of the public could see that this was a really serious and organised programme. And members of the public could donate by clicking on the QR code, and the QR code would take them to a website that would tell them the story of what this was all about. Next slide, please. We had to internationalise the campaign. Same poster, same message, lots of different languages. And every time you clicked on a QR code, irrespective of which country you were from, you went to the same website. Next slide, please. But of course, if you look in the top left-hand corner, if you click the QR code in Norway, you would read the story in Norwegian. If you clicked it from Poland, you would read it in Polish, etc. This isn't the entire website, but basically it says, please don't send boxes. Ukraine is desperately running short of medicines. Pharmacists have got special expertise in being able to procure these medicines. Please make your financial donation. Now, this is really, really important, that pharmacy organisations don't collect any of the money that's donated. Next slide, please. So what you need to do is you need to create this kind of an infrastructure. You need a national pharmacy organisation. I happen to be from the UK, but members in Europe were from lots of different countries. We each had to find a local charity that would agree to team up with this effort, because it would be their job to collect the money and account for the money. And when we needed the money to procure medicines, it would be their job to release the money to pay for them. Now, it also needed a coordinating organisation to make sure that somebody could design the website, somebody could create the posters, somebody could get all of the memorandums of understanding organised. So we created, by accident, as we walked through this episode, an operational framework. Next slide, please. This operational framework enabled us to make collections in many countries across the continent, and actually it then enabled us to centralise the funding, and you would be surprised how quickly you can make quite big donations when you start to collect the resources gathered across the whole of the continent. Next slide, please. By March of 2023, so these figures are even higher now, so in a year after the campaign started, we raised more than £3 million. It wasn't all just because of the posters. Some of the countries were already very well established and had charity connections. They did really, really well. One country in particular managed to gather nearly €2 million because they had an established charity operation, and they were well known for this kind of work. One country had established a charity just before the crisis in Ukraine started, and within 2 months had managed to gather nearly €1 million. Whereas some of the other countries, the UK is in that number, in one of the other countries, in the UK, in a year, we managed to generate £235,000, which isn't to be sniffed at, but actually the reason why we didn't do more, and Catherine talked earlier about what are the challenges, one of the challenges was we really needed to be up and running and signed with charity arrangements in place, in position, before a crisis actually happened, because the countries that were in that place did substantially better. Nevertheless, together, working together, far more than £3 million worth of money was raised, medicines were procured, they were sent to Ukraine. I remember going to FIP Congress in Seville last year, and I put together an appeal to FIP to say, could FIP do something about this? Because this is a structure, this is a framework that could benefit people in other parts of the world who are also suffering with humanitarian crisis problems. And I'm absolutely delighted to be able to announce that at the FIP Congress in Brisbane, this idea became formalised and accepted by the FIP Council, and this has now become a formal partnership programme for FIP. We're only just starting this partnership, but guess what? I was absolutely delighted to have seen the first country from Africa, South Africa, who signed at the signing ceremony at FIP in Brisbane. So that's our short story on how we can start to build from small initiatives into something larger. I'm delighted to have been involved in this, and I'm really happy that pharmacy may ultimately be able to make a beneficial and dynamic difference to the lives of patients in humanitarian crisis areas. I'll hand you back to Catherine.
Thanks so much, Mark, and your point is very well made. If the FIP vision is for a world where everyone should have access to medicines, then that's even more important in the times of a crisis. So without further ado, I'm going to hand over to our colleague, Lars Söderlund, who is an FIP Vice President and is here because he's the co-chair of the FIP Technology Advisory Group. And Lars, you're going to present to us some of the digital services, the opportunities, but also recognising that we need to manage this very well if we're going to benefit patients and the public. Over to you, Lars.
Thank you so very much, Catherine. It is indeed a great honor to be with you all today, celebrating the 5th anniversary of the Astana Declaration. Next slide, please. I would say that the integration of new technology... please go back one slide. Okay. Anyway, the integration of new technologies to optimize pharmacy workflow has been transformative in recent years. And I would say that digital health services encompasses a range of technologies and innovations that have significantly impacted the pharmacy profession. I mean, these services include telepharmacy, e-prescribing, medication management apps, medication therapy management software, drug information databases, and of course, telehealth integration and more. And overall, the technology has empowered pharmacists to play a more vital role in patient care, emphasizing medication management, adherence, and education, while making healthcare services more accessible and convenient for patients. On this slide, you may see a list of technological innovations that have been shaping our profession in recent years, and that will continue to impact the work of pharmacists in the years to come. And as we look towards our profession in 2030, we must understand that some of these technologies will not only change the way we do some of our current activities, they will actually also enable new services by pharmacists and may represent a quantum leap in the role we play in healthcare. For example, having full access to the patient's electronic health record will not only allow us to access information that will empower us to advise the patient and inform our actions, it will also represent an enormous change in terms of our accountability for treatment outcomes. So this technology change represents a paradigm shift in how we perform and has also significant ethical implications. Next slide, please. So innovative solutions that make use of digital and automated technologies have enormous potential to improve quality of care and patient safety, improve multi-professional collaboration and communication, increase health literacy and self-management, and automate administrative and logistic processes at the pharmacy so we can spend more time working on healthcare delivery and directing patient care. And of course, also personalized healthcare services and improve therapy outcomes. Next slide, please. As such, we need to re-envision our services in community pharmacy. It's important to understand how healthcare, as well as consumer or patient beliefs, confidence, and experiences in the development of primary healthcare is changing. Patients have overall adopted a more consumer mentality towards engaging a lot more in their health, seeking to meet their needs on demand. And we need to meet patients where they are, because this is a growing business structure, you can say, across multiple care modalities. And also, of course, patients do seek for convenience, lower prices, and increased accessibility. And in many countries, already the home is becoming the center of care. Next slide, please. As such, we have some examples here, so we can see a lot more of expanded pharmacy services in pharmacy diagnostics, where we actually can use smaller devices and we can see the rise of enhanced diagnostic tools. We can do a lot more of pharmacy testing services, and we can also, as we have heard before, continue to develop the role in prescribing, as well as have collaborative practice agreements for pharmacies to modulate therapy for certain conditions. Next slide, please. We can see a trend towards pharmacy at home, where we actually can engage a lot more services in the home by this supporting the patient through mail order and on demand, as well as using connected devices to track medication utilization, and also, of course, do a lot more of therapeutic monitoring, remote therapeutic monitoring for disease management, and also, of course, encourage people to enroll in wellness programs, etc., to improve clinical outcomes. Next slide, please. And of course, we are also adapting to virtual care, where we will have a lot more of remote patient monitoring, as well as remote therapeutic monitoring. Next slide, please. As such, I would like to highlight the need for patient engagement. And as you can see in this slide, the emerging technologies and innovation is actually driving the 4 P's of patient engagement: participatory engagement, predictive analytics, personalized treatment, as well as preventive care. And in all these areas, pharmacists will have a crucial role in supporting the patient, and also using a lot more of the data that is created within the system. Next slide, please. And as you can see in this slide, patient engagement is vital in today's healthcare landscape. And here you can see a number of different opportunities, and also, I would say, benefits of using the patient as a collaborator on equal terms. I would say that the patient engagement is the blockbuster drug of the century. Well, patient engagement is not a product of the digital revolution. We live in a well-connected world now, but patient engagement becomes an easier mission for the healthcare providers with advancement in technology. And this topic has garnered a lot of attention in recent times. So it is expected to have the highest growth in the age of digital healthcare in the coming years. And of course, giving power to the patient and making them accountable for their health will lead to better health outcomes. Next slide, please. Yeah, I think that's all for the moment. Thank you.
Thanks so much, Lars. So we're going to look at the Mentimeter findings after the panel discussion, because time, as ever, is short. And I'd just like to welcome all of the panelists today. We don't have Faraz, he's had to leave us from WHO, but he gave us a very, very comprehensive list of what FIP should do. We have Mark, we have Lars, we have Kirsty, and of course we have some of the team members from FIP as well, who can answer and respond. So I thought what I would do would be to target a question, first off, for Kirsty. Kirsty, you're a director in the FIP Hub with a particular focus that goes back on workforce development in particular. And I think it would just be really useful for us to start with you, get your insights into how has the Astana pharmacy workforce been strengthened and weakened, we can even take it. But what initiatives have been implemented that enhance pharmacy education and training that you're able to draw on for the panel today? Thank you so much, Kirsty.
Thanks, Catherine. First of all, maybe I'll take that from the perspective of the profession and then maybe loop it back around to education and training. As I was getting prepared for the webinar, I was having a look at one of the other fairly recent FIP reports around the pharmacist-led common ailments scheme. And I was really sort of energized by reading the report because of the fantastic work that's going on with really what Ian was talking about scope and role change. And what we're seeing globally now is in response to a really strong demand for improved primary health care, is pharmacists really stepping up into that space to help deliver those primary health care services. It comes with some challenges of its own, and we're in Australia grappling with some of those challenges. And so some of the things that I've been writing some notes while I've been learning a lot by listening to the speakers, but we really need to talk about this from a whole of workforce perspective. This is not just about pharmacists. And we have workforce shortage, even in Australia, a very well-developed country with very strong healthcare services. We have a workforce shortage. So if pharmacists are going to step up to meet the needs for primary health care, the rest of the healthcare workforce needs to shift and change as well. And really here I'm thinking about the support workforce and the technical cadres who are stepping up to help us look after our patients. The other, and of course, you know, education and training is important here as we train up our workforce to do these roles. The only other thing I want to say while I've got the floor is really fascinating presentation about digital health from Lars. The thing that we're not struggling with in Australia but really have a focus on is how we communicate and share the information around patient care and using digital health tools to enable that communication. Because if we're doing providing primary health care and the rest of the healthcare team is not aware, then the patient potentially doesn't get the best care either. So a couple of things to focus on: a whole of workforce approach and keeping the patient at the centre of all of this and making sure that we're communicating cleverly so that it's not creating more work, but that we're making sure that the patient's getting the care that they need. I hope that answered the question, CD.
Oh, Kirsty, that's such a wise answer. So I think that digital is enabling and a fantastic, technological advances are fantastic. But when I look at even my parents who are frail and getting older, I think we can have some really big issues on literacy and therefore inequity as well. So I think with every advance that we see, we also see some cautionary tales, and we don't want anything to really alienate one part of the community or another. And I couldn't agree with you more, Kirsty. I think the workforce is there, but needs to be sustainable. We need good packages of remuneration and job roles, and to increase satisfaction, not just layer on more and more work. I think we need to look at cold and hard at this post-pandemic, and I think it's really good to see the focus at WHA on mental health and resilience alongside all of that. So it's really, really important. And if you could just stay, Kirsty, and maybe we will have you for a couple more minutes as we go to the general questions. But before I do, I'm going to go to Mark now. And Mark, how do you personally see the partnerships between pharmacy and local communities or national members for primary healthcare and humanitarian work through to 2030? What would be, you've given us some really concrete examples, but what would be your take-home nuggets, your principles of practice, so to speak? Thanks, Mark.
Thanks, Catherine. I think the take-home nuggets here is that if you have a fire in your kitchen, you're always tempted to go and run and grab a bucket of water and throw it on the fire. And we should carry on doing that. But actually, what's much more important is that we create a fire service. We create a number you can ring, 999, when there's a problem. You create structure, you create organisation. And I think if we want this project to be successful, we should aim by 2030 to put that structure and that organisation into place. Now, that doesn't mean we won't be able to respond to issues as they come along, but really the most important target for us is to actually create that structure. So Part of that means that we have to work more collaboratively as national pharmacy organisations, because sometimes you don't know what's happening in the next country, in the next country. In this space and in this project, we all have to work in a collaborative way. The second thing is I'm hoping that through FIP, we'll be able to build some formal and recognised connections with international organisations like WHO and other NGOs, so that we can ensure that we can learn together and we don't reinvent the wheel, and they can learn, well, pharmacists have got something to offer here. Perhaps we should work together with them. So we need to develop those links. But I have to say personally, other than the obvious, which is we will be helping a lot of people as we go, and I've seen that already in Ukraine, one of my things that I would say as a pharmacist is we want to get the next generation of younger pharmacists to understand that actually reaching out and putting a helping hand to those in need is something that comes as part of being a pharmacist. And it doesn't matter whether we're servicing those patients in our pharmacy or in our hospital department. We look overseas as to those patients who also require the support of pharmacy. And we need to understand that that's part of our responsibility as well, wherever we live, whichever part of the world we live in. And that's possibly something that we want to bring in at undergraduate level. We've been very successful. We've gone around with our programme to schools of pharmacy in the UK, and students are absolutely delighted. In fact, I'm just about to take off to go to Oslo with a pharmacy student to do a presentation about humanitarian there. So it's a very, very important part of it. So there's lots to do.
There is lots to do, but you know what, Mark, you never get there alone. So it is about doing things shoulder to shoulder, and perhaps another opportunity for FIP to look at our pharmacy schools oath and really talk about how we're all humanity, and putting the human back in humanity can really make us feel part of the solution, especially at very, very tough times globally. So Mark, let's follow that up with some actions as well. And Lars, and may I just say, colleagues, we're going to stay with the panel to 30, and then I'm going to avail of a final extra 5 minutes as I do a little summary with the Mentimeter, understanding some people may not be able to attend, but I've got my panel here, so I'm going to use them. So Lars, what innovative pharmacy practices or technologies for you, give us one or two, have emerged since the Astana Declaration? I mean, that's also since the pandemic as well. Lars, over to you.
Exactly. Yeah. Thank you so very much, Catherine. Well, first of all, I would just say that the expanding scope of services, community pharmacies are increasingly now being recognized as essential primary healthcare providers. They are expanding the scope of services beyond traditional dispensing of medication. And of course, when it comes to medication management, pharmacists are now playing a more significant role in medication management, which involves ensuring the safe and effective use of medications. But I can also see a strong trend about collaborative care, where collaboration between community pharmacies and other healthcare providers, such as physicians and nurses, is growing. So pharmacist-led intervention in areas like chronic disease management, smoking cessation, and adherence counseling are becoming more common, as well as public health initiatives. And of course, we cannot forget to mention telepharmacy services, because technology has played a significant role in the evolution of community pharmacy during the last 5 years. And telepharmacy services are becoming more prevalent, allowing pharmacists to provide care remotely. I think that these are some examples of how actually the profession has evolved during the last 5 years.
I think you're spot on, Lars. And I think this comes to Kirsty's point about it's not an either or, is it? Telepharmacy isn't instead of the pharmacist in the pharmacy being able to advise you. That's why we need to get our workforce in a good place with sustainable practices. So a final question for the entire panel then, colleagues. You've seen all the challenges. It feels like a challenging time in our world in October 2023. I think it's important for us now to join together to address those challenges as a profession. And how do you think the role of pharmacists now can step up and step into the space for the next 5 years ahead? And I'm going to start with Kirsty, because I do know Kirsty might have to slip out in a moment, and then I'm going to go to Mark, and then I'm going to go to Lars.
Past my bedtime. Look, you know, we're on a trajectory really as a profession, aren't we? If you look 5 years ago, and I think that trajectory has been hastened by COVID. You know, pharmacists stepped into the breach in a lot of places. And will that trajectory keep going? Yes, but The other really important thing that's come out of the presentation today is our focus on our workforce's wellbeing and resilience. And certainly what I'm seeing is a bit of a rebound from COVID. A lot of our workforce doesn't want to work full time anymore. A lot of our workforce is not interested in doing further study. You know, they're very, very focused on their well-being, which they absolutely should be. But that is having a big impact on our workforce. And probably the most important thing for our workforce, if it's going to continue to step up and help provide the primary health care that's needed, is that we work out how to better support our workforce and that they're able to manage their well-being, because otherwise the workforce, all those benefits we've seen of pharmacists stepping up, we're going to lose that as pharmacists are, you know, it's not what I signed up for, I don't want to do this. So I think we really, really need to focus on how we're going to help our profession, you know, get back to a position of strength where they want to get up in the morning with a bounce and go off to work and continue to look after patients who really, really need their care and attention.
It's such wise words. And that's why, Kirsty, I think looking at the CPS report that's launched today looks at all of that, sustainability of the workforce, but really looking at, you know, not just adding work to people's portfolios, but thinking about them as individuals. And I think that comes to the humanity piece. Moving swiftly along then, Mark, what would be your vision and your thoughts for the next 5 years?
I think Kirsty's given a very, very good response there. In the UK, we're seeing a pattern now where pharmacists are only wanting to work 2 or 3 days a week, and it's specifically for the reasons that you've just described. And in situations like this, you have to go with the tidal flow. You can't swim against it because you won't actually get anywhere. So in recognising the fact that people want to manage their well-being, we're seeing a pattern in the UK where pharmacists will no longer work in those places that they don't feel comfortable in. You know, there's not enough staff. It's a prescription factory. It's a chore. They don't want to go to those places. Where do they prefer to work? They want to pick and choose the places where they get professional fulfillment. They get some excitement. They get some interest. They get that patient relationship, because in many pharmacies they don't. In a lot of pharmacies, they're just in the dispensary. Somebody else is seeing those patients. So I think taking on board everything that Kirsty said and what we know about workforce, and considering transforming the roles of pharmacists going forward to make sure that those roles do give pharmacists professional fulfillment. But the sacred cow is that we have to forsake some of the traditional roles, the assembly, the dispensing. We have skill mix now, we have robotics, we have technology. So we shouldn't fear these things, because they can support moving pharmacy practice forward, creating those professionally fulfilling roles, and hopefully re-attracting far more people and getting them switched on again to wanting to help those patients. And I believe that that's very much the case, because we've already seen the pattern in the UK. There is a relatively straightforward formula. You give somebody a really good job, they tend to want to get far more engaged than otherwise would be the case.
That's right, Mark. And I think, you know, remembering that, colleagues, is part of our mantra. We know that workforce is going to be super, super, super imperative for FIP to address next year. So we should pull all of these strands together. Lars, what do you see as the next 5 years ahead of us?
Well, I agree with both Kirsty and Mark, but I also think it's important to engage even more with patients, because one area that I think is very important is patient awareness and acceptance. Patients might not be aware of the full range of services that pharmacists can provide, or may not be comfortable seeking healthcare advice from pharmacists. So overcoming these perceptions and awareness barriers can be challenging. Also, education and training, adequate education and training are essential for pharmacists to expand their roles in primary healthcare. So continuous professional development and training opportunities can be limited in some regions. And of course, we have mentioned the workload and burnout. High workload and stress can affect the quality of care that pharmacists can provide, as well as job satisfaction. So this leads to burnout and potentially impact also patient care. And also another area is on a general perspective, think that regulatory bodies are lagging behind this exponential development in primary healthcare and overall in healthcare. So regulations related to pharmacist practice can vary widely, and some regulations might be outdated or even restrictive. So changing these regulations can be slow and a very challenging process. So I think we need to speed up there. And of course, as mentioned before as well, workforce shortages. We need to make the profession extremely attractive again, because we are the gateway to primary healthcare.
No better man to finish the panel's discussion points, I have to say, Lars. And might I also say that we should now keep that mobilization of our regulators. As we had in the pandemic, we had such good examples of where regulations were flexibly applied, and we seem to see a little bit of a rollback on that. So that's something I think we can take. Now, the team have put the word cloud on here. I'm going to hand to Farah just to walk us through this, and then I'm going to gather my thoughts for the final sum up. But we've got some of the responses, haven't we, Farah?
Thank you, CD. This will be quick. So for the first question, we asked you about the top 3 influences on global health, including pharmacy and the broader societal aspects. We received 29 responses. In the middle, as you can see, we can see access, cost, non-communicable diseases, environment, vaccination, crisis prevention, again, technology, pinpointing all of the themes that we discussed during our event today. And if we go to the next question, we've asked you about the barriers that pharmacists face in primary healthcare, and how do you envision FIP providing support to overcome these barriers? And some of the barriers that we've heard from the audience are access, involvement, recognition, competency, and then we've heard remuneration of services, professional barriers. There's a lack of implementation of the law that supports primary healthcare in particular. There's a lack of infrastructure and a lack of awareness among other stakeholders. Regulatory problems, funding models to promote pharmaceutical cares. Pharmacists don't know what the role is, so we need awareness, and there should be house jobs for pharmacists and proper training and education. Enhancement of the scope of practice that FIP may encourage flexibility and equity, and also and focus on primary healthcare. We have antimicrobial resistance and the idea of pharmacist prescribing, clarity of the role and the understanding of expertise, and the status of pharmacists that should be promoted and protected in all countries. Handing it back to you, CD, for the closing remarks.
Thank you, Farah. Thanks a million. I'm going to say 3 points, really. There's something here about examples of where pharmacists make a difference. And in some countries, we have great evidence of that. We need to share it better across the countries, but also then to turn these into advocacy tools for our governments and health ministries. And that's part of the FIP journey and plan for 2024. I think having the impact database is going to mean people can mine and search what FIP has already at its fingertips. And I think today I want to pay a special tribute to Ines, Susanna and Oscar, who've been filling up that chat box with stuff that FIP has already, whether we've published it or we've launched it or we've shared it. And this will become an event that we can research and use as a data source in the future. And literally, I've mentioned before, team, that the job as the CEO of FIP is the best job in the world, but I also have the best team in the world. There's a competition for anybody. Can I, before I close, just say a really big thank you to Faraz in his absence, and Kirsty, who I know has had to leave, and Ian as well, but also to Lars and Mark, who remain here on our panel. I think there's something here about FIP responding to what we've heard in the chat, in the Q&As today as a team, but using this as a marker. 5 years in position at FIP, 5 years since Astana, 5 years of constantly responding to patient need, global pandemics, global crises, and being a little bit more human in our response, but also being more responsive, full stop, seems to be the way to go. So we are here because of our members, but also for our members, and we want you all to remember that. I wish you all a happy Astana. I think that's a nice celebration to have. And I'm really wishing you all well, Mark, as you move to EFU. Good luck there. Ruben, I know, is speaking there, and I've offered a few words. But to everyone else in the team and online, let us know how we can support you. We will follow up with a summary of this event, and this will frame our work for the 5 years ahead. Thanks a million. Thank you all. Take care.
Thank you so very much.